Now, the preventative approach is now a very important issue in medicine, because what we are trying to do is to identify people over the age of 35 who will be at risk for cardiovascular disease, in other words, strokes and heart attacks and diabetes. And these entities can be identified very early in one's life with the proper tools. And you literally, it's like discovering the fountain of youth, which is insulin resistance. If you can dominate and if you can conquer insulin resistance, you are prolonging the life of that particular patient. You are delaying the time when they are going to develop diabetes, when they are going to develop high cholesterol, when they are going to develop then heart attacks and strokes. So, and I think this is one of the missions for this clinic, is trying to identify people who have the metabolic syndrome, which is this cluster of problems that will lead to an early demise because of these cardiovascular problems. And a lot of them are endocrine problems. Number two is to identify, for example, people who are going to be at risk for osteoporosis and will break their bones, people who are at risk for diabetes, people who are high risk for high cholesterol, people who have thyroid disease. It's estimated that around 20% of the population suffers with thyroid disease, and half of them will never come to the attention of a physician.